Hello, everyone. My name is Juan Espinosa, Director of Student Success here at the UCLA School of Nursing. Today, we have 5 alumni who are coming back to our school for our alumni panel this quarter. We'll go around the room for some introductions. First, on Zoom, we have Chelsea Abad. Chelsea's experience includes emergency department RN ranging trauma levels 2 to 1 from 2013 to 2019, nurse practitioner in dermatology from 2017 to today, and flight nurse in California Air National Guard from 2021 to 2021 till today. Her career has taken her in many places to the US and abroad. She's had the blessing of meeting many different professionals along the way that have been instrumental in her growth and achievements. She has been able to act as a preceptor for RN and EMP students, teach community courses, and participate in authoring educational documents that are featured in prominent scientific and medical journals. On the military side, she finished a deployment overseas in March 2025. That's Chelsea. In the room, we have Lindsay Kasamasima. Lindsay graduated from the UCLA School of Nursing in the Megan class of 2012. Upon graduating, Lindsay began working in the PICU at CHLA, where she worked for 11 years as a bedside nurse, hospital committee member, preceptor, and relief charge nurse. In 2023, she left CHLA and began working as a nursing instructor at West Coast University. Here in the room, we also have Clarissa Gabil. Clarissa is a clinical nurse 3 in a level 4 neonatal intensive care unit in ICU in Los Angeles, California. She earned her BSN from UCLA and holds certifications on neonatal care, critical care, and neonatal touch and massage. Clarissa is a member of multiple system-wide and unit-based committees at her hospital, including the NICU, Unit Practice Council, and Magnet Council, leading initiatives to foster professional development, improve clinical practices, and advance nursing excellence. Currently, Clarissa is pursuing her PhD at UCLA, where her research hopes to focus on improving neonatal outcomes through the development of tailored systems for neonatal pressure injury and wound identification, staging, and prevention. Through her clinical and research endeavors, she seeks to generate evidence that bridges science and practice to optimize the quality and safety of neonatal care. Here in the room, we also have Shelly Kenji. Is a 2023 graduate of the Megan program and currently works as a nurse in the surgical intensive care unit at Cedars-Sinai. She's passionate about patient care and professional growth. Outside of nursing, Shelly enjoys baking desserts, practicing Pilates, and spending time with her family and friends. And lastly, but certainly not least, on Zoom, we have Lindsay Morales Wang. After 7 years as a labor and delivery nurse, Lindsay attended the MSN FNP program at UCLA and graduated in 2013. Since graduation, she has committed her career to serving the underinsured and marginalized communities of the San Fernando Valley, working at a federal qualified health center, Northeast Valley Health Corporation. She is passionate about advocacy and mental health and has her prenatal mental health certification to the postpartum support internal and in the process of getting her psychiatric mental health nurse practitioner certification. She is an active board member of the California Association of Nurse Practitioners, Tri-Valley chapter, and the volunteer frontline provider for Postpartum Support International. She lives in Northridge with her husband and 2 daughters and loves being a nurse practitioner. All right, we're gonna go ahead and get started with the first question. Um, the focus of this panel is nursing specialty, so we're gonna go ahead and get into that. Um, for folks in Zoom, let's start with you all. What are some recommended experiences for students interested in your specialties? How about Lindsay on Zoom?
Can you repeat the question again?
What are some recommended experiences for students interested in your specialty?
Um, my specialty at this time is a family, primary care, and things that they can do. I mean, my program was F&P at UCLA. Um, is the question like extracurricular activities? I'm not too sure.
Any kind of professional experiences?
Well, I mean, family medicine is pretty general. So, um, finding your niche in family medicine is also something I recommend, like mine. I found out that in family medicine and primary care, um, mental health and psychiatry is important to be practice in primary care. So being comfortable with that um, is important. Um, but when I was in school, just really being open to anything. My clinical sites during school were at Kaiser Sunset, a pediatrician in the West Side, um, Planned Parenthood. So just being open to all of it and the exposure to everything is important. I did the mobile clinic through UCLA that treats homeless in WeHo, and that was a great experience too. So I think trying everything, trying different types of clinical sites um, and seeing what really, pulls you and where you're passionate is important. I think that's what I would recommend.
Great, thank you for that. How about Chelsea? Same question. What are some recommended experiences for students interested in your specialty?
Oh, I totally froze. Um, okay. So in terms of like my specialty, so my nursing background was in working in the emergency room, and I currently work in dermatology as a nurse practitioner. I think that for anyone who wants to pursue ER nursing, definitely during your immersion experience, during your senior year of school, try to get that immersion in an emergency room just so you can get your feet wet and see how it is. Additionally, there are a ton of new grad programs that are also in the emergency room. Off the top of my head, I believe that there's one at Northridge Hospital, potentially at Cedars-Sinai, and I think at UCLA as well. So just something to look into. And then as it comes to dermatology, someone wanted to pursue, their advanced practice license. I was able to do some experience during my program when I went to University of Pennsylvania for my degree. I was able to do sort of extracurricular um, clinical shadowing with a dermatologist during my program. And then once I graduated, I worked initially in an internal medicine practice, which does involve a little bit of skin, but then I was able to network and meet a Mohs surgeon who was willing to train me. And it just went from there. So I think that putting yourself out there, networking, and trying to find ways in which you can gather or gain that experience in any way you can, whether it be through shadowing, I think only helps you.
Great, thank you. We're gonna go ahead and switch it up to the room. Um, Same question for Lindsay. What are some recommended experiences for students interested in your specialty?
Sure. Well, I would say pediatrics in general, if you have any um inkling of thinking you're going to have an interest in pediatrics, then you should definitely give it a try. I know a lot of people are turned off by peds or scared of it. But I have so many colleagues who never even had like pediatrics in nursing school at all and just wound up in the field and love it. So if you have any inkling at all of thinking that you might be interested in it, try to do your immersion at a pediatric hospital, or at least one that has some pediatrics that you can get, or at the very least, try to shadow a nurse in a pediatric unit or something like that. Um, Specifically, I did PICU for 11 years, which is pediatric ICU, and I went straight into it. I went straight into a new grad program, and I think there's nothing better than doing a new grad program. If you can find whatever, you know, specialty you go into, if you can find a hospital that actually actively really wants to do the teaching and invest in the time and giving their new nurses some really good training at the beginning, I think that is such valuable experience because as great as UCLA nursing school is, you still learn so much once you're on the job. So any sort of new grad or training or orientation process is something I would definitely be looking to in wherever I'm job searching. And then in terms of now I'm a nursing instructor at a school, I think that, if that's something that you would want to pursue, I think it's all about that lifelong learning. As nurses, we're always looking for new opportunities or trying to grow our knowledge base. So, you know, stretch yourself and see what you can find, and you'd be amazed at like what opportunities become available, and just stay connected with people.
Great, thank you. How about Shelley?
For me, I originally started in the advanced heart failure unit, which wasn't the plan at all. I did my immersion in the ICU of the VA. I always wanted to do ICU, but going into the ICU for advanced heart failure was really helpful. Like I learned like time management and taking care of patients that I didn't really want to work with, but push myself to, how do I say this, to bridge myself to the ICU. So things that you can do to get into where my specialty is like obviously doing your immersion in the ICU. But again, I remember it being difficult for everyone to get an ICU position there. So you can do volunteer work. I remember doing that a lot. In my ICU, and I think other places as well, you can have at least one volunteer on each side. You get to bond with the nurses, bond with the CP, the MTs, everyone, see the process of what we do every day. You can also get like your T card. It's a trauma care after resuscitation program. I would say connections are probably the biggest thing because you can only do so much on your own, but when you have someone to guide you, it's going to help a whole lot. Connections.
Thank you. But Clarissa, same question.
I've been speaking to a lot of nursing students recently, and I've heard the kind of climate it is to try to get a new grad position, and also immersion placements. I remember when I was a nursing student, I thought where I ended up was based on my immersion placement, but I want to ensure everyone I actually did not get an immersion placement in the NICU because it was during COVID when I was still in nursing school. So there is hope, even if you don't have a lot of experience in the unit that you want to pursue. I would just highly recommend, if you do have a specialty in mind, to look into certifications to make yourself stand out within a pool of applicants in a new grad program. So I had my BLS, I had my ALS, I had my PEDS certification, and I feel like that made me stand out for NICU. When I'm reviewing applicants for our new grad program, we look at their certifications. So some of the new grads have SENS, which is a NICU specific certification. So those are just some of the things I look at. And what really helped me, if you have the time, was everyone saying experience. So because I knew I didn't have a NICU immersion placement, I actually worked as a care partner at UCLA. The skills that I acquired from that experience, I really highlighted in my application for the NICU and in my interview that all of the skills that I have are translatable within a neonatal ICU unit. So don't feel discouraged if you don't have an immersion placement or any of that. Just really go ahead and make yourself stand out by getting those certifications and figuring out maybe what specialty you want to do. And if you don't know a specialty, even better, because just getting in a new grad program, I feel like is a great transition into clinical practice.
Thank you, Clarissa. For our next question, we're gonna go ahead and start with Lindsay again. How do you make yourself a competitive applicant as a new grad?
Can you repeat it again?
Yes. How do you make yourself a competitive applicant as a new grad?
I think just like what Clarissa said, like making sure you have all your certifications will make you competitive. But I think being flexible also is important. If, when I was applying for my first job out of NP school, I was applying to everything. I was applying to full-time, part-time, anything, and just interviewing and getting a feel for everything. And the flexibility was very helpful. And I think that companies are looking for someone that they can mold. And I think that's what helped me. What else? I mean, especially in California, speaking Spanish or having some kind of another language that you do speak is very helpful. I'm bilingual. I speak Spanish, so that was very helpful, and it helps me in my clinic in the communities that I like to serve. It's difficult for me. I mean, I take a lot of NP students from UCLA, and it's I see them struggle when they don't speak anything of Spanish. So if you could, improve your Spanish if you're thinking about staying in California, I definitely recommend that to be competitive.
Thank you. Chelsea.
Yeah, I'll just kind of echo and reiterate what others have said. I do think trying to highlight certain certifications that you've already obtained. Of course, if a hospital doesn't have to pay to have you do BLS, ACLS, PALS, that'd be fantastic. So having those already on your application could definitely make you stand out. I think any volunteering experience of any kind, honestly, would be very, very useful as well. I think essentially trying to highlight that you are a well-rounded individual, which I know others have said also during the panel, would be it's very, very useful. So trying to show that you have done various volunteering activities, especially at UCLA, there are so many opportunities that are available to students for volunteering, especially in like a sort of like a medical based, or at least something that has like kind of like a medical or nursing background. Again, off the top of my head, I know there's like a mobile clinic that UCLA has, and there's um, there's a partnership with the Pain and Turtle, which is in Lake Hughes. Not horribly far, it's not crazy close, but that's a pediatric camp for children with these chronic conditions. So things like that I think would be very useful. And I mean, I think if you're multilingual, I mean, that would be great too. I do know that a lot of hospitals do require that you have a certificate. If you are going to be using any other English or speaking to patients in any other language than English, you do usually have to have some a type of certification that shows that you are able to be like an interpreter, sort of. I don't know what that certification is called because I do not have it, but maybe pursuing and obtaining that certification would also be useful. And those would just kind of be some of the things that I could think of that would be helpful to make you a competitive applicant.
Great, thank you. How about Lindsay in the room?
Um, trying to think of, in addition to what others have said, like any of those certifications obviously are great. I would say like maybe highlighting like what Chelsea was saying about being a well-rounded individual. If you highlight any like critical thinking skills you might have, even if they're from like a completely different job background, or like, if you make sure to highlight those things, whether it's on your resume or your interview, like that you are um going to be a critical thinker. Maybe it's, classes you've taken or articles you've written or whatever that is. If you have something that makes you like, I'm not just a nursing student who got A's and like did well in my immersion, like created relationships. Maybe it's because you volunteered or because you put yourself out there and you shadowed, or you like, if you show that you have gone kind of like the extra mile and sought out opportunities, even if they're not in nursing, it shows that you are the type of person who is willing to learn, who's willing to give the effort. And like, you can be creative about what you have in your background that highlights you as that type of person. I think those are the type of people that at least hospitals are looking for, I think, in a new grad candidate.
Great, thank you for that. Shelley.
I feel like we're all going to end up saying the same thing. So I agree with what everyone has said, but I'd also say like maybe going to like side conferences is a big thing. You learn so much that you can bring back into your interviews, into your future jobs. But aside from that, I feel like something that was really big for me when I was interviewing was working on my people skills and really showing who I am as a person. Because as a new grad, especially, you don't have too much behind you to back up like how great you are as a nurse. So at least being a great person, a great coworker who's ambitious, who wants to learn, who wants to help, who when all your tasks are done, you're not just gonna sit there and be like, oh, well, I'm good. Like you're gonna be the one that's going out to help with the admission next door, helping clean the bathe the patient across the way, like, you know, just being more helpful besides just taking care of yourself.
Great, thank you. Marissa.
Yeah, what everyone's saying is great. Also, just do your research on the new grad programs that you're applying to, the hospitals that you're applying to. Because I'm pretty sure if you're a UCLA student, you're ready to stand out, but you want to brand yourself and want to make the hospital want you and how you fit into their culture. For example, when someone mentioned like flexibility, applying at anywhere you can. So I applied to so many different hospitals all over the country just to also get interview experience, like what Shelley was saying. And then when you apply to these different facilities, you notice a difference and what their priorities are. So for example, UCLA is the only hospital that includes kindness in their mission statement. So that's something that I've highlighted in my cover letter, in my resume. But it's the little things that really matter, even though we're trying to tell you to do so much. But yeah, just do your research, and the more you apply to, the higher probability that you're going to hear back and even learn from your experience from applying somewhere. So hope that helps.
Thank you. Great answers all around. For our next question, how would you describe your work-life balance as a nurse? We'll switch it up a bit. Go ahead, Lindsay.
Oh, sure. It's hard, I think. I think what's amazing about nursing, at least in terms of like shift work nursing, is that even if you're a full-time nurse, you still have 3 full days or nights. Well, however, if you're, you still have 3 full days off and sometimes 4. And I think there's just a lot of people who kind of figure out their work-life balance however it works for them. Like, if you're a night shifter because you have young children and you want to see your children off to school and then go to sleep, or you want to cook them dinner and then go to work, like that works for a lot of people. If you, decide you're going to work every Friday, Saturday, and Sunday because you want to be available Monday through Thursday, that's great too. Like there's a lot of ways that you can make your career and your personal life kind of mesh together and really fit well together. I think it just takes a little time to kind of figure out what it is that works for you. I would definitely say though, no matter what type of nursing you are in, you must take time for yourself and do the things that are going to rejuvenate you, because you cannot give to families and patients if you have no reserve, if you have nothing in the well. So whether that's hiking, reading books, going out to dinner, I remember during nursing school going to a panel and someone saying, make sure you have some people to laugh with. And I really took that to heart. So like you always have to find your group, whether it's your friends from nursing school, because you can talk about things that you understand that maybe your family members can't, or it's your college friends, or whatever it is, your woman group, your guy group, whatever it is. Find those things that give you back your well of strength and energy. And I think then you can figure out eventually with your schedule, like how you can make all that stuff work. Hopefully that makes sense.
Yeah, absolutely. Shelley.
I would say for me, finding a unit and a specialty that you're super passionate about, it'll not be so hard to balance life and work. Like I love my unit. I love the people in my unit. So when I'm not at work, we're always hanging out. Like later today, we're all going to go to the Bubble Museum. So it's kind of like work and life kind of mashed together for me because that's how it works best. But I do think it is really important within like your first year to find what works for you outside of work, so that you're recharged to come back to work and give 100%. One thing that people get tied up in is wanting to be so good at what they do and being like the top of it that they're studying outside of work. Get off work, you come home, you study, you go back to work. That's what I used to do, which is great. But definitely find the people who make you laugh, things that are going to make you feel refreshed, take care of your mind, your body, your soul, your family, all of those, and everything else will follow.
Thanks. Marissa.
Reiterating what everyone said, obviously finding, some time for yourself off the units and recuperate. But also, I think the big thing that got me through my new grad program was mentorship. So find a great mentor, someone you could talk to who might understand what you're going through. That's something I look for in a new grad program. UCLA has a match mentorship program. So as soon as you are a new grad, they actually match you to a new grad from the year before. And that was really helpful. She like talked me through certain situations. Like I didn't know how to do this, and I would just text her and she'd be like, it's okay. Like there's so and so on your unit you could just talk to, just guidance. So even if they're not like on your unit, maybe just finding someone or meeting someone else in your new grad program to talk to you, that would be great. And I'm sure all of us, if you want to reach out to any of us, I don't want to speak for anyone here. We're more than happy to probably help you and mentor you as well.
Thank you, Clarissa. How about Lindsay on Zoom?
Yeah, I don't know. I don't know if I have a balance or not. I'm just kind of, stretched thin all the time. But the funny thing is that I add more things to my plate on purpose because it fills my bucket, right? So um I found a passion in nursing that I'm pursuing, and that makes me feel good about myself. So if that means continuing your education, getting another certificate, changing your specialty, whatever it is, as long as it fills something for you, I say do it. Um, and I think, asking for help when you need it is also really important. If you know yourself and you're on the verge of a burnout, take that break, take that girls trip, or take whatever you need to get refueled. But asking for help is also important. I know that as a new grad, it's difficult to ask for help. You feel like you look weak, but really, I think it's a form of strength. You know yourself, you know your limitations, and if you can ask for help when you need it, I think that's best.
Thanks, Lindsay. How about Chelsea?
A huge proponent of self-care. So yes, to the self-care. Do you think you should find something that is going to regenerate you, ensuring that you are drinking your water, that you're getting your 8+ hours of sleep, 7 to 8? Those are all things that are going to be really important, not just for your mental health, but for your physical health as well. And I think something else, because like what everyone said is honestly like amazing and very valid. I also think that saying no sometimes is also going to be really helpful and useful in some of these settings. I will say I currently have 2 jobs right now. I mean, I'm a dermatology nurse practitioner. It's my full-time civilian job. I'm also in the Air National Guard as a flight nurse, and I do deploy. I have to fly every 90 days. And to be honest, it can be really difficult to manage all of that. And so for me, I mean, I've been doing this for a while now. So time management is super important, but also being able to say no to certain things and feeling okay with that, knowing you cannot be everywhere at once. You will run yourself ragged if you are always trying to be the best, always trying to say yes to everything because you want to be, I want to, go out there and help. And that's fantastic to have that mindset. But at the end of the day, you will run yourself ragged. And I think it's really important to find that balance. And with time and experience, typically you will eventually find that balance. But don't be afraid to say no if you have to.
Thank you, Chelsea. For our next question, what are some qualities or characteristics that you look for in a potential employer? About Lindsay on Zoom.
Employer or employee, like the employer
Yeah.
The employer. Yeah.
So for me, because of my background and my passion with, serving the homeless and the underserved, the marginalized communities, I needed to make sure that the organizations I applied to had these missions, were treating these type of people that needed the help, um, most of the help. So, reading their missions and their visions, and their values and seeing if they match with yours, I think is really important. Um, I've worked in organizations where the population is different and needier, and it's been difficult for me. I felt the struggle and need in caring for that population. And so I knew that I could not sustain, you know, that type of life, that type of nursing care. So I needed to find something that was more aligned with my values. So I think, you know, doing a self-reflection, seeing what's important to you, and making sure that that's something that you find in the organization you're applying to is important.
Thank you, Lindsay. How about Chelsea?
You were a little low when you first said the question. Do you mind repeating it one more time?
Of course, yeah. What are some qualities or characteristics you look for in a potential employer?
Yeah, so I do think that looking for when you're looking at employers, that it's really useful to look at like their PTO, vacation, time off, sick time is really important. What your benefits are going to be. And benefits include obviously your health insurance, but additionally, it could be additional benefits. Like, for example, City of Hope offers additional benefits for full-time employees as well as part-time employees that include decrease in your medical insurance premiums if you want to engage in like yearly like medical checks to make sure that your like blood glucose is good, your blood pressure is good. So there's these things that you can do in that regard, but also too for your education. So do they offer plans or some kind of benefit that you are not basically that's going to be employer paid to send you to conferences or other educational opportunities that you can get not on your dime. So those are all things that are, I think, really important, as well as mentorship opportunities. How will they develop you as a leader? Are there other avenues you can go down, like research opportunities in the future? So you want to look at things that are going to help you be a well-rounded nurse or clinician in the future.
Thank you. How about Clarissa in the room?
And as Chelsea mentioned, like professional growth opportunities is huge, especially if you know you want to go back to school. So what your employee offers for that. I think I kind of touched it earlier, like looking at their mission, vision statements. It's kind of, if you have the privilege of being able to choose your employer as a new grad, like that would be great. But yeah, definitely look into it, what their values are, what you value as a nurse as well.
Thank you, Shelley.
One thing that was really important for me was observing the people who were interviewing me and kind of like catching a vibe. Were they just being like straight faced, monotone? They barely were interested in what you were saying. You know, was it very like way too formal, or were they like super cool, smiling, laughing with you, asking you like who you are outside of nursing, things like that was huge. Because I interviewed in one unit where it was like I felt like it was cutthroat. Like I couldn't sit up straight enough in the interview. But then other ones, like the current unit I'm in now, it felt like a conversation with a friend. And that translates into who they are as a leader, to guide you in your professional career as a nurse. So catch a vibe is what I say.
Great. Lindsay.
Yeah, I don't have much to add. I think what everyone said is spot on. What opportunities are there? What benefits are there? How are you going to grow? How are you going to be supported? And then culture for sure is something like I know people who got jobs in areas or units that they were not even interested in because they just felt like those were their people and those were going to be the people who supported them the best through their growth and their learning. And they were going to be a good nurse while surrounded by those people. And that might not last forever, but at least at the beginning, if you have a choice, if you can find the people who you are going to feel safe with and you're going to want to do well and do good for others, like I think that's a huge part of what I look for in a workplace because work is work.
Mm-hmm.
So we want to get all that stuff out of it too, but it needs to be a place where you wake up in the morning, you're like, yeah, I want to go there.
Great advice there. Thank you for that. For our next question, what is the most rewarding experience you had here at the UCLA School of Nursing? I'll give you a minute to think about that one. How about Chelsea online?
To be honest, it was actually my immersion experience that I had. My immersion was in the ER at Santa Monica UCLA or UCLA Santa Monica, but it was fantastic. I loved going there. I loved every minute of it. I had a wonderful preceptor that I actually like still am in touch with to this day. So I graduated in 2013. So it's been over a decade. Um, but it was great. The other nurses besides my preceptor were very, very welcoming. They wanted me to learn. They would seek me out in addition to like just my preceptor, offering these opportunities for me. They would seek me out and be like, "Hey, look, come watch this," or "You want to do these chest compressions right now?" And it was really, really helpful. I had a wonderful time there. It's by far one of the better experiences that I've had tons of great experiences at UCLA and UCLA nursing, but that's one of probably something that stands out the most to me.
Thanks, Chelsea. How about Lindsay online? You're frozen.
Lindsay, I think you're muted and maybe frozen.
Can you hear me now?
Yeah.
Okay. I think my connections with my fellow classmates and my preceptors and professors was the best thing that came out of UCLA for me. I made some really great friends, best friends that, ended up coming to my wedding a few years later. So, I think that um, nurses are wonderful because we're people, right? So we like to connect with other people, and doing that at UCLA just felt so easy. Um, but I think I also got lucky with my placements with, Kaiser Sunset, and the doctor who I was precepting at Kaiser Sunset, he was one of the founders of the mobile clinic at UCLA. So right in line with, serving the homeless with me. And so it just kind of was like a jumping board for me to continue that kind of work out of UCLA. So I think, everything's important, everything is special, but I think the connections you make with everyone at UCLA is important.
Thank you, Lindsay. How about Clarissa here in the room?
Honestly, I would also say my immersion, but then like when he asked that question, it's like my best friend from nursing school came to mind, we both started our new grad together. She moved back home, so we're not in LA anymore together, but we kind of still push each other. Like she applied to go back to DNP school, so that's what she's doing, and I'm back in PhD school. So it's nice to go through these life changes with someone. And if you could, find someone from UCLA, whether it's a fellow nursing student or someone of a different major, your roommate, like I really think those people were there during such formative times of my life. I'm really glad to see that we are able to sustain these connections outside of UCLA.
Thanks, Clarissa. How about Lindsay here in the room?
I think, yeah, I loved my pediatric rotation, and that was what originally like made me want to do peds, and my immersion there too. But I had one clinical instructor who, I really connected with, was actually my OB clinical instructor, and I remained in touch with her after I graduated, and I really wanted this job, and I was like getting interviewed for it, but like they were telling me that I wasn't going to get it. And I was like, well, what am I going to do? And so I reached out to her, and I used her really as a sounding board and a mentor because nursing was my second career. And so I was like, I don't know, maybe I made a huge mistake and like all of this. And I was really doubting. And I reached out to her, and she spent a lot of time talking with me. We had multiple conversations, and she really helped me get into a good, space. And then I ended up getting the job in the end. And, maybe I wouldn't have, maybe I would have, who knows? That's not really the point. But I had this tremendous connection with her. And I think that really was something special that came out of my time here.
Thanks. Shelly.
I would echo everyone is saying with finding like their best friends. I feel like this is the place where you find like your people for the rest of your life. But aside from that, I would say the most rewarding part was learning just how capable I am. Because before nursing school, I wasn't a school person. I didn't feel like I was the smartest, just all these things. But once I came here, like I really felt like I belonged and I was flourishing, like very involved. I was getting the highest grades and I actually understood why I was getting the highest grades, you know. So just finding my purpose here was probably the most rewarding thing.
Thank you for that. For our next question, what advice do you wish you had received as a new grad, in terms of graduating and venturing into finding a new job? What advice do you wish you would have known at the time that you know now? Well, Clarissa, what do you think?
Yeah, someone once told me if it doesn't evolve you, don't let it involve you.
Mm,
And I think that really stuck with me because as a new grad, you're just like trying to find your place. You, like Chelsea mentioned, like you don't want to ever say no to someone, even though maybe you should. And I wish someone told me like it's okay to not have to do everything all at once. Because when you're a new grad, you're gonna fail and you're gonna learn, and it's gonna be hard because you're finishing UCLA on such a high. Like you accomplished all this stuff, and then you get into a new setting, you're like, I don't know anyone here, I don't even know what I'm doing. But I hope you know that you're not alone, you know, like it's okay to step back if you need to, like, you know, to reach out to support people that you need. And if a unit doesn't click with you, then that's totally okay too. You shouldn't have to stay in a new grad program that doesn't serve you. And I've seen people leave the nursing profession altogether because of that. So don't feel discouraged. We need nurses out there. And if you're a UCLA graduate, I'm sure you're going to be a great nurse.
thank you, Clarissa. How about Shelly?
I would say to stop and smell the flowers, like truly enjoy having the expectation of basically nothing. Like you're not expected to know everything. You're not expected to have the greatest skills. Like enjoy that and use it to your advantage and be like, hey, I haven't done this before, or I've only done this like twice. And people are going to teach you their way of doing it, and you're going to figure out what makes you the best at doing it too. Um, One thing I wished I would have done was really enjoy being a student at UCLA more. Like I feel like I was very grateful at the time, but just knowing how simple just being a student was, because once you graduate, life goes crazy. So enjoy being a student and soak that in. And then when you're a new grad, soak that into love being new to absolutely everything and just figure out your flow.
Great, I love that. Thank you. How about Lindsay?
Yeah, I would definitely say even beyond that, be humble, like be okay with like and embrace not the not knowing. You know, like Clarissa was saying, like you just graduated from UCLA. You're like the smartest one in the room. Like you know everything, right? But you know nothing. So like that's okay. Like don't worry about it. Like tell someone you want to learn. Tell them you want them to teach you. Like be humble about it. Don't be the person who's like, oh, I know how to do that. I mean, if you do know how to do it, then absolutely don't be afraid to show people you know how to do it. But at the same time, like if you don't know how to do it, don't pretend you know how to do it because this is nursing. This is like people's lives. Like we want to learn how to do things safely and take care of people. So be okay with being like, show me more. I want to see how to do that. That's okay. I think it's okay to admit that you don't know.
Great, thank you. How about Chelsea online?
Um, I, of course, agree with everything that's been said. I also add just two things. Like one of them is that, you know, depending on where you end up working and some of your coworkers, I think something to remember is to not take things super personally towards yourself, if that makes sense. Like, I'm just going to share an experience I've had that I do feel like others have also had as a new grad, especially in the emergency room. I've heard this is kind of common in the ICU. I've never worked there, but I've just heard this too. Is that it's kind of that phrase that I'm sure everyone has heard of it, like nurses eat their own, especially when if you've been there for a very long time. Um, just be cognizant of that. Definitely be humble for sure, but also at the same time, just kind of like keep your wits about you, if that makes sense. Be really open to training, but also to be open to like, or not open, but identify anything that might be, I don't want to say toxic, but just people who are maybe not being so kind to you, and doing your best to manage it in a professional manner. Because I'm just to be honest, this is going to be probably your first, I mean, you're a new grad, so this is going to be your first like real professional full-time job. And there are going to be some individuals out there who are not going to be nice to you, clinicians included. So just learning how to manage that, leaning on those around you and your support, so that way you're not like just sinking under that pressure, or you're letting people mistreat you or treat you poorly. So just make sure that you are utilizing those around you and your resources to kind of manage anything that might be difficult in that regard. Some people are not very nice, honestly, to new grads, and I hate to put that out there, but it kind of is a truth.
Mm.
Also, additionally, this is just like my little like finance plug, because obviously as a new grad, it's not like you're going to be making a bajillion dollars right off the bat. Don't feel like you have to like get the newest, latest, and greatest of everything. You know, budget it out, and don't feel like you have to buy 20 pairs of figs at once because you need to fit in with the
Mm.
crowd. And so I only mention that because I was that person. So don't blow your whole paycheck on all these things. Make sure that you are taking care of yourself and your finances. But that would be my recommendation.
Thanks, Chelsea. How about Lindsay online?
I agree with everyone. And just a little bit like what Chelsea was saying, I think that um, one recommendation I have is advocate for yourself. Yes, you're new, but you belong in the room. You belong there. You've deserve it. You've earned it. So if you have a question about something, a protocol, not to be like the know-it-all new grad, get your research, get your information. Actually standards of care have changed now. Can we maybe talk about how we can improve this way instead of this way? Like you're coming from a great institution, and you belong there. So just don't forget to advocate for yourself, even if you're new. And that's it.
Thank you. We're nearing the end of the hour, so we're gonna go ahead with our final question, and I'll give you a couple minutes to think about it. What does it mean to you to be a Bruin nurse? Just remembering your time here at the School of Nursing, your clinical rotations, taking classes here with our faculty, your friends, the time that you spend here with us. What does that mean for you? About Chelsea online.
So I will kind of I think what it means to be a Bruin nurse is to step forward and move forward knowing that you have a very like excellent like education behind you. You were prepared. Don't forget that. Stay confident in that. But I also think that being a Bruin nurse is someone who is going to always pursue excellence and ethics and prioritize like patient care and their needs like above all else. You're there to provide care and serve patients, and being a Bruin nurse is doing that at the basically at the top level, the best of the best.
Thanks, Chelsea. How about Lindsay online?
I think for me, it means two things. One, I think we owe it to each other, to the profession, to the institution, to be leaders in nursing, whatever that means. Taking um, a more professional, more political stance, um, a more visual leader role in whatever space you're in. Um, it's our job to make this profession grow. Right now, it's being challenged, and so we need to stand together and really push each other and show others that we are professionals and we deserve the respect that we should get every single day as clinicians. Another thing is that although we have succeeded and we've completed, whatever program we're in, we have the duty to reach back and to help students behind us and make it to a higher level of nursing. Encourage high school students, to make it into this profession and be leaders in this profession. Um, so those are my two takeaways. I think as a brew nurse, we're supposed to be leaders in our profession and make sure that we help those who want to follow in our footsteps.
Thank you, Lindsay. How about Clarissa in the room?
Being a brew nurse, everyone said such great things already, but I mean, like I mentioned, UCLA is the only hospital that has kindness in their mission statement. So be kind to the people we work with, not just your patients. Be kind to the new grads that you might eventually precept one day, and most importantly, just be kind to yourself. So as you practice it wherever you end up, just learn to always choose kindness, no matter how hard of a shift you're having, no matter how bad your patient or how you're feeling that day. Um, choose kindness and just reiterate what everyone else is saying, essentially.
How about Lindsay?
I have a tremendous sense of pride having graduated from UCLA. I think there's not a better school. And so take that with you for sure and own that. But also, like what Lindsay said, I think I feel so much now that I'm teaching nursing students, I feel such a tremendous sense of responsibility, but also pride in the nursing field. Like it doesn't matter that I'm not teaching here at UCLA. Like I'm teaching nurses to be amazing nurses, and I feel like I have a duty to send them out there to the world to take care of people in the way that, I was taught to do that here. So, because they're going to be taking care of me one day. So I just really want to, I feel like as a Bruin nurse, like that is part of my job is to really instill what I learned and into like that next generation of nurses because we are so important to the health and well-being of our communities and our families and just everyone out there. So I feel that's a really important part of what I do as a nurse.
Thank you. But Shelley?
I would say be proud of where you came from and all the work that you did to get here because it translates into your life outside of school. I feel like when I met people who also went to UCLA, it all kind of feels like a mini family in a weird way. Like, oh, you went to UCLA? Oh, me too. And then all of a sudden there's like this amazing bond out of nowhere. So being proud of that, the foundation that you've built here is incredible. I feel like UCLA is very transformative and progressive in the way we move. We're very prideful in nation, while still being super humble. Um, and we create really great work ethic and self-discipline, which isn't as common as we think. So take pride in who you are and what you built while you're here. I'd say I'm just really proud of the family that we have here at UCLA.
Wonderful answers all around. Thank you so much. We're going to go ahead and wrap it up. Thank you, everybody, for joining us today. And thank you again to our 5 wonderful alumni, Lindsay, Chelsea, Shelley, Lindsay, and Clarissa. Thank you, everybody. Have a good day.
Thank you. Nice to meet you all.
Thanks so much.
you.